leaders for inviting me to this most important meeting. For the last 40 years, my research is focused on the mechanism behind atherogenesis in cardiovascular diseases, development under oxidative stress. In atherosclerotic patients, blood flow is through a very narrow lumen as cholesterol-rich lesion is built up. Thanks to the IVUS intravascular ultrasound, we now know that the lesions start towards the middle of the artery, and only then later on it becomes a lesion which developed into the event of myocardial infarction, MI. The diagnosis often comes too late for coronary artery disease and cardiovascular disease in general. Myocardial infarction or death, sudden death, as initial presentation of coronary artery disease are faced by as many as 62% of men and 46% of women. This result suggests that we must know much better our CVD risk factors. The major risk factors are high level of cholesterol, mostly the LDL, the cholesterol major carrier in the blood, high blood pressure, smoking, and diabetes, and all of these cause the formation of vulnerable lesion and the event that followed it. I'd like to concentrate on cholesterol because it's one of the major risk factors for atherosclerosis and cardiovascular diseases. Coronary heart disease risk increases as plasma cholesterol increases, and you see it in two big studies. The higher the cholesterol in the blood, the higher the mortality from cardiovascular diseases. And the opposite is also true. The lower the cholesterol in the blood, the lower the coronary heart disease risk. Even more, for 1% reduction in blood cholesterol, you have twofold reduction in the risk for cardiovascular diseases. If blood cholesterol is so important, what are the sources for the blood cholesterol? And there are two major. 2/3 of the blood cholesterol is coming from body production, and the factory for production of cholesterol in our body is the liver, of course. 1/3 is coming from the diet, and we can do a lot about this part. And in general speaking, we are saying have much less consumption of cholesterol and saturated fat, and have much more fruit and vegetable, and even fish from the North Sea, because they are rich in omega-3. But we know it from thousands of years. Let food become your medicine was an Hippocratic saying. Speaking about blood cholesterol, we do not have free cholesterol in the blood because it's not soluble in the water environment of the blood. We have the cholesterol on lipoproteins. The LDL and the HDL, low-density lipoprotein and high-density lipoprotein, are the major carrier of cholesterol in the blood, but HDL has also a lot of phospholipids which enable it to remove cholesterol from the arteries back to the liver and out of the body. We know that the higher the LDL, the blue bars, the higher the coronary event. And the opposite is true for HDL. The higher the HDL, the lower the risk for cardiovascular diseases. We know how to treat high level of LDL. We still do not know good enough to increase low level of HDL. For LDL, we have the statins the Lipitor, the Simovil, which increase the number of receptors on the liver, and by so doing will result in reducing the concentration of cholesterol in the blood, LDL. HDL, it looks now that there are mimetics of HDL that can do the job for low level of HDL. But the quantity of cholesterol in LDL as well as in HDL is not the whole story, because blood cholesterol quality, and we are talking about quality, we talk about oxidative stress, inflammation, LDL oxidation, is as important risk factor for macrophage foam cell formation in the arterial wall and for atherosclerosis development as is blood cholesterol quantity. From a prospective study of over 500,000 people, we now know that intake of red and processed meat rich in oxidized lipids is clearly associated with increased cardiovascular disease mortality. How can we inhibit LDL oxidation? As some specific fruits are rich in polyphenol antioxidants, these fruits can possibly attenuate the oxidation of LDL. Major sources of antioxidants are plant fruit, and they are found mainly in the fruit skins to protect the fruits themselves from oxidative damage. Dietary antioxidants include tocopherol, carotenoids, and mainly the polyphenols that you already heard this morning about them. Polyphenol-rich nutrients that we studied in our lab include Mediterranean fruits as well as the fruits from the Israeli 7 species: pomegranate, grape, fig, date, and olive. Not only olive oil, but also olive leaves and even olive water, the first fraction that you get when you wash the olives. They are rich in polyphenol and can affect oxidative stress dramatically. The polyphenols protect against oxidative stress mostly in water environment. Our body, however, is consisted of water and also lipid phases, and thus there is a need to protect the body against oxidative stress also in the lipid environment. This can be achieved by olive oil phenolics, by vitamin E in olive oil, and by oleic acid, the monounsaturated fatty acid. And you can see here that oleic acid, as opposed to linoleic and arachidonic acid, the PUFA, the polyunsaturated fatty acid, oleic acid reduce oxidative stress, whereas arachidonic and linoleic acid increase oxidative stress. Also, you already heard that there are several phenolics like oleoperin and hydroxytyrosol, and tomorrow you will also hear about the derivatives of oleoperin and hydroxytyrosol. All of them, they are very potent antioxidants. We started in 1993 with our human oxidative stress study with olive oil, and human LDL fatty acid composition and phytosterol, beta-cytosterol content were first studied before baseline and after 2 weeks of olive oil diet, 50 grams per day, and you can see a significant increase in oleic acid in the LDL and a decrease in linoleic acid, which results in reduction, time reduction already after 1 week and more so after 2 weeks in peroxide in the LDL. Total polyphenol content in extra virgin olive oil found to be significantly higher than that in olive oil, and as a result, there is a more pronounced effect of extra virgin olive oil comparing to olive oil in the reduction of peroxide oxidation of LDL. What we observed, and I'm not going to the details here, just we observed a dual inhibitory effect of olive oil on oxidized LDL accumulation. One is the free radical scavenging by oleate, vitamin E, and phenolics. And the second one, to the right, you can see hydrolysis of oxidized derivative of oxy-LDL by HDL-associated paraoxonase 1, PON1, as well as by the glutathione system. In order to analyze the effect of olive oil on atherosclerotic lesion, we studied the anti-atherosclerosis effect of extra virgin olive oil in the atherosclerotic ApoE deficient mice. What we observed is that extra virgin olive oil significantly decreased the lesion size, and extra virgin olive oil that was enriched with green tea polyphenols even did a better job as an antioxidant against LDL oxidation. Olive oil is an important part of the Mediterranean diet. The combination of olive oil with Mediterranean diet constituents provide an additional health benefit, as you heard from Ramon, and this brings us to the Mediterranean pyramid. Not only diet, but also lifestyle. As far as diet, we are talking about a pyramid with only few times a month of red meat, few times a day of eggs and fish, and a daily consumption of fruits and vegetables. As far as lifestyle, we are talking about exercise in moderation, weight reduction, no smoking, 1 resting day per week, and 2 meals per day, just 2. And this is also from Ramon's study. Among 7,500 persons at high cardiovascular risk, a Mediterranean diet that was enriched with olive oil for 5 years significantly reduced the incidence of major cardiovascular events. So to eat or not to eat, what depends on what you eat. Vegetable and fruit are preferable. How much you eat, do not get too fat. With whom you eat, do it also always with friends. When do you eat? In the morning, like a king, at noontime, like a prince, and at night, like a poor man. And the Mediterranean 10 Commandments, I will leave it, and thank you for your attention. Thank you from the city of Haifa to the city of the Vatican.